Welcome back, and great to have you here with us on WKYT. It is very normal to shed some hair each day, but excessive hair loss is a big concern for both men and women, and there is a treatment that can help stimulate natural hair growth.
Here to tell us more about platelet-rich plasma, or PRP therapy, is Dr. Patrick Davey. Thank you very much for coming in.
Thank you for having me.
So first question, what is PRP?
Well, PRP, it stands for platelet-rich plasma, as Barbara said.
Yeah.
And what that involves is we take a tube of blood and then we spin the blood down so that the larger elements in the blood, like the red blood cells, which give us oxygen, the white blood cells, which we use for infection, are left behind. And then we take the top part of that, which has the platelets, and platelets actually plug holes in our body. So if you have a hole in one of your blood vessels, it'll plug the hole. But they also have a tremendous number of growth factors that are within them, and then also within the surrounding media that we have with the platelets. And that's really what we're after.
So how is it used? How does this work?
Well, it's been used a number of different ways. For years, it's been used for joint problems, for people that have bone problems. And the growth factors, what they're doing is that they're helping you regenerate the joint space or to go ahead and regenerate the bone. Now, what we have up on the screen is actually two treatments with platelet-rich plasma that's been used, injected in this case, and you can see that the amount of hair that we get back from the baseline on the left-hand side.
Is it injected at the site of the hair loss, or is it put in somewhere else? Yeah,
well, we inject it actually at the site that we want to use it. There are a number of different methods that you can do to do that. Currently, what people are doing is using something called microneedling, where you actually will needle the surface of the skin and you can put it in that way. And we're also using laser devices, so the lasers will actually make channels in the skin, and then we can put it on the surface of the skin and it'll absorb through the skin.
Pretty amazing, the things that we see. Is it permanent?
It is permanent, yeah, in terms of the growth factors. Some of the studies now are showing that you might need to have a retreatment. Say you have 3 treatments, you might need to have a retreatment in 6 to 12 months. But we're all, individuals, so it just depends upon the individual how they respond to it.
So is maybe a consultation first is the best?
That's probably the best thing to do. And then we're also, moving into other areas. For example, the sun damaged skin that we deal with every day as dermatologists, this can be used for that type of treatment of sun damage too, in addition to it.
Certainly something for people to check out. Dr. Davey at Dermatology Consultants and Skin Secrets.
And dermconsultants.com, your website.
Yes.
Good to see you.
Thank you.
It's always good to see you.
All right.